disabled people will be affected by Brexit in a number of ways and in a number of far more serious ways than people who are not disabled. Quantifying the impact of Brexit is very difficult, as it will depend on the shape of the withdrawal, the future relationship with the EU, and future policy intentions. And the impact is likely to take years to fully emerge. So that bit about getting Brexit done, well, you can park that for a start off. Now, in terms of the history of EU legislation, now the EU, European Union, has undeniably acted as a vehicle for improving disabled people's rights. The UK has also long been a proponent of disability rights. It was early in its adoption of legislation such as the Chronically Sick and Disabled Persons Act 1970 and the Disability Discrimination Act 1995. However, the European Union has been pivotal in enhancing the rights of disabled people in the United Kingdom. A major example of this is the Employment Equality Framework Directive 2000, which went beyond the UK's 1995 Act by removing the exemption for small companies and by extending coverage to indirect discrimination. The European Union has also played a significant role in negotiating the United Nations Convention on the Rights of Disabled People, which you doubtless have heard an awful lot about today. That is pivotal, okay? Now, that UNCRPD now ensures disabled people's rights are considered across EU policy. Anti-discrimination provisions are also present in other areas of EU law that are not headlined as such. For example, EU law requires providers of transport by air, as well as by train, ship and bus, to assist disabled passengers, and the bus directive requires wheelchair accessibility. None of that happens before the EU. The EU has also introduced accessibility improvements for medicine packaging and recently for public sector websites and apps. So there are risks. By virtue of the EU Withdrawal Act 2018, these rights will be retained in the immediate aftermath of Brexit, i.e. between now and the 31st of December this year, though regression will still be possible now. We need to be vigilant. UK government record towards disabled people in the context of welfare reforms doesn't provide much reassurance, as I'm sure everybody in this room is aware. The more likely risk is that the United Kingdom may not keep up with improvements it otherwise would have benefited from while in the European Union. The upcoming EU Accessibility Act's improvements for a variety of products and services, from computers and operating systems, ATMs, smartphones and banking services to e-books, are potential candidates of the UK falling behind EU directives. In terms of EU funds, obviously the European Union provides a variety of initiatives which directly improve disabled people's lives. European funding in the form of research grants, the European Social Fund, the European Regional Development Fund and Interreg benefit disabled people through socially inclusive employment projects, supporting disabled people's voices and participation, as well as projects to adapt technologies to disabled people's needs. The European Social Fund currently gives £500 million a year to organisations in the United Kingdom that provide employment and training support for people who are often neglected by mainstream providers. And obviously, the risk of where we're in, the loss of this European funding could be potentially disastrous for disadvantaged groups, including people with a disability, if not replaced fully. In terms of reciprocal healthcare and related arrangements, the UK government is currently looking at the future arrangements for reciprocal healthcare with EU countries. These current reciprocal healthcare rights include, as I'm sure you know, state pensioners have full access to healthcare in the country they retire to. The free EHIC, European Health Insurance Card, allows people temporarily visiting another EU member state to receive emergency healthcare. The Blue Badge Scheme is recognised across the EU and there are reciprocal arrangements in place. UK Government Department for Transport officials are currently working with European Union officials to negotiate the continuation of this Blue Badge Scheme agreement. So the risks. The loss of EHIC cover, that's the European Health Insurance Card cover, would be particularly significant because it covers pre-existing conditions. An expensive feature of private travel insurance, which will disproportionately impact disabled people. We would hope that the Blue Badge scheme will be protected for use across Europe, but there is currently no guarantee. Finally, concerns as regards the UK government approach under Boris Johnson's leadership. So how long have we got? But anyway, I was going to crystallise it into about 5 major concerns, and you can question me about any other number of concerns. So number 1, a no-deal Brexit is still a very real possibility. And a no-deal Brexit means any rights that we thought we would have completely disappear on the 31st of December. So a no-deal Brexit is still a possibility, and the probability has increased substantially due to the self-imposed 11-month deadline introduced by the UK government to get Brexit done. Second concern, disabled people have always felt ignored. I mean, I've been a GP in Swansea now for 35 years, and it's one of the more constant issues is the fact that trying to get parity of treatments and referrals and everything for people with disabilities. UK government haven't even carried out an impact assessment of the impact of Brexit on disabled people yet. Don't hold your breath over the next 11 months. In contrast to the UK government's relative silence on these matters, the Scottish government has openly discussed these risks of Brexit on disabled people. The Welsh government, obviously, also, to be fair, not always a phrase that I come out with, but doubtless John will emphasise the fairness of the Welsh government now. But anyway, the Welsh government has also made available a dedicated page on the Preparing Wales website, which acknowledges the risk of disproportionate impact on disabled people. Both devolved nations are actively exploring incorporating the UN Convention on the Rights of Disabled People into domestic legislation in Scotland and Wales, so we may see different legislation being proposed between different devolved parliaments. Next concern, we need to ensure that the Welsh Government has a seat at the table in terms of making the case of negotiations. You know, since we've had the Brexit referendum 2016, Welsh Government has supposedly been involved in Brexit negotiations, back and forth, up and down the M4, has never actually been fully in the room. It's been in the room next door occasionally, sometimes been in the same building, never at the same table. So there are different definitions of how involved Welsh governments are in negotiations as regards Brexit. Up to now, has not been involved at all, I would contend. We would like to ensure that Welsh Government has a seat, at least, at the table, making the case in negotiations from now on. We voted against the LCM, the Legislative Consent Motion, as you know, against the European Withdrawal Bill very recently. Scottish Parliament did the same, Welsh Parliament did the same, Northern Ireland Assembly did the same. What happens? It's happening anyway. Amazing, isn't it? What involving the devolved nations actually means. So, in closing, with the first phase of Brexit now complete, we need to ensure that disabled people have their voice heard in shaping key elements of the post-Brexit environment. I cannot pretend it's going to be in any way easy, because we all face a huge slog to get our voices heard. Boris Johnson has a huge majority, and he can just drive through what he wants. And whenever I stand up and say things like this, people always have a whinge, because they say, that's what people voted for. Yes, people did vote for this huge majority, and it's going to be used and abused in the years to come. So, with only a 11-month transition period, the pace of development is likely to increase and to be very challenging for all of us. Diolch yn fawr.